Warm greetings to all of you. I'm Abdul Kareem from the Taylor's University, Malaysia. I have chosen this topic of research for presentation today, an analysis of trabecular pattern for identification of an individual and anthropometric measurement of the knee joint to determine gender and age. My co-researcher was Dr. Bashir. In fact, the aim of this research is to establish the relationship between the trabecular pattern of the knee joint with the age and gender of an unidentified individual. We also make an analysis of the trabecular pattern for its uniqueness in each and every individual. So that was my aim. To explain to the methodology, first I will explain to the normal architecture of the distal end of the femur and the upper end of the tibia. So these are the two bones that constitute the knee joint. And these bones have typical pattern of the trabeculae. These are all the trabeculae. You can see the trabecular pattern here. So we can analyze the trabeculae individually. And this is the important point. 7 criteria are given for the readers to observe all these findings. Number 2 group of finding that they have to see is application of anthropometric measurement. We can see the joint space between the two bones. They have to measure the two far ends of the condyles. And also they have to measure the medial ends of these condyles to see the notch. And also they have to measure the height of the intercondylar notch, and they can make the indices of this. So these are all the 4 important measurements that they have to do around the knee joint. For your information, this is the lowermost condyle in profile view, and this is the notch. So they have to analyze this notch, measure this notch height and width, and also analyze the trabecular pattern of this area. And the third important group of findings they have to observe is to look for the degenerative changes, as we note here. That is to fix the age of the individual, whether they belong to the middle age or elderly age. The children are not included in this study. All these findings, they were analyzed by the 2 radiologists. They were not allowed to discuss among themselves. They have to make independent findings and record their findings. And these findings are analyzed by SPSS, and the outcome was displayed in various form, tables, histograms, and images, as we observe here. The most important thing that I want to impress here is the ROC curve. So the ROC curve proves that this study has got high sensitivity, about 90%, and also medium to high specificity of 60%. The area under the ROC curve is 0.7 plus. So reaching 0.8 means it is in excellent shape. So with these findings, we are very much impressed with this study. 4 important findings that I want to impress the audience is: number 1, all measurements are higher in male. So we can use this data for differentiating the gender. And also, on contrast to our expectation, all measurements are increased in elderly age group. So that is an important observation in this study. And third important finding is the trabecular pattern in each individual is unique, so that can be applied for the individual identification. The 4th point is the degenerative changes are common only in the elderly and not in middle age group of the patients. So with these findings, which are very solid, we can apply to individually identify the dead bodies and reduce the burden in the world, because there are millions of dead bodies in and around the world. And for example, in USA alone, 1 million dead bodies are there in heartland. So the government is finding difficult to dispose this. So I recommend this study to be extended to all parts in Malaysia as well as in the world. And I finally acknowledge my university for having granted me the grant for this. And also I acknowledge and thank INFOMEC for having given me the chance to present this. And I thank all the assistance I got from all the sources for making this research possible. Thank you very much.